Governor Brian Kemp hoping to solve the issue of limited access to COVID-19 vaccinations in our state. And while he announced last week that the state cannot offer the vaccine to more people right now, Georgia is expanding who's allowed to administer it. Paola Soro live right now looking into what is actually allowed under the governor's new executive order.
Yeah, good morning, Sheba. You know, the administration of the COVID-19 vaccine has been slower than anticipated. Even Governor Brian Kemp has said so. So he signed an executive order to hopefully try and speed things up that way. The order now allows registered nurses as well as nurses who have license that expired in the last 5 years to apply for a temporary permit to administer the vaccine. It will also allow that group, in addition to medical assistants and physical assistants, to put the shot in people's arms while being supervised remotely. Prior to this executive order, they could only administer the vaccine under direct supervision. Now, to put this in context, as of Sunday afternoon, Georgia ranked 14th slowest state in the U.S. when it comes to vaccine administration. That's better than the statistics we've been seeing earlier this month when Georgia was the slowest state for vaccine administration on some days. Now, prior to this executive order, Governor Brian Kemp also signed another order that would make it easier for dentists, pharmacists, and EMTs, among other groups, to administer the vaccine.
Paola, thank you. And this week, more vaccines will be freed up to go to county health departments. They'll be getting about 40,000 doses that were set to go to long-term care facilities. The governor says Georgia is still only receiving 120,000 vaccine doses per week. More than 2 million Georgians are eligible to receive a vaccine.